So good morning, BSN1G. Today we learn about bed bath. So before we proceed to our return demonstrations, we need to first discuss what are the procedures to be implemented during the return demonstration so that we know what are the sequence or what the step-by-step in doing the bed bath. But before we proceed to that procedure, first one, we need to define what is bed bath. So pag sinabi nating bed bath is a type of bath given while the client is on bed. So what are the purpose or what are the purposes why we need to give a bed bath to our patients? Number one, to make the clients clean and feel comfortable. Number two, we need to increase the sense of well-being. And number three, we need to promote the muscular relaxations and relieve feelings of fatigue. So that is the purposes of our bed bath. So what are the equipments needed in this bed bath rather? So first one, we have the wash basin, the bath blanket, the bath towel, the washcloth, the patient gown, hamper for soiled linen, gloves, soap, hygiene supplies. So hygiene supplies like the lotions, powder, and deodorants. And then we need also the bedpan and the urinal. So that's are the instruments or equipments that we use in our bed baths. So what? Let's proceed to the procedure. The first one procedure is to assess the client's to tolerance for activity. So what is the rationale? So to determine the client's ability to perform self-care and level of assistance. And then we need also to assess the room temperature and the ventilations. To warm the room prevents rapid loss of body heat during the bathing. So these are the assessment part. And let's proceed to the planning. So planning, yes, we need to also to in assessment we need also to provide privacy by drawing the curtains and closing the doors, so to allay the fear and anxiety. And especially we need to explain the procedure. So in explaining the procedure to promotes the client's cooperations and participations. And also we need to offer bedpan or urinal rather, so the clients will feel more comfortable and allowed to continuity of work. So let's proceed to the wash hand. So alam na natin yan. So need to wash hand to reduce the spread of microorganisms. And also we need to gather all the necessary equipments that we need. So if we gather all the necessary equipment, so we need to identify the patients and explain the procedures. And also we need to provide the privacy of our patients to offer a bedpan or urinal. Sabi ko nga kanina, to clients feel more comfortable and allow continuity of the works, and adjust the bed to a comfortable working height positions. So to prevent the muscle strain on the part of the healthcare provider. So yon. And then place the blanket over the client before removing the top sheet. So in the blankets, that is provide warmth and privacy. And then remove the client's gown, ensuring he or she is covered with a bath blanket. So this one to provide full exposure of the body parts during the procedures. And after that, if the client has an IB, don't forget to remove gown first from arm without IB. Do not disconnect the tubing. So if an extremity is injured naman, remove the gown first from the uninjured side. So bakit? So undressing an affected or uninjured side first allows easier manipulations of the body parts with reduced range of motions. Okay? And after that, we need to put the side rails up and fill the basin with warm water. So to maintain the client's safety, warm water promotes comfort and relaxations of the muscles. And After that one, we need to place the client in a semi-powerless position and remove the pillow if permissible. So why? So removal of the pillow makes it easier to wash the client's ear and necks. And after that, we need to make a meat of the washcloths. So to protect the client's skin from the nails of the healthcare provider, meat retains water and heat that a loosely held cloth. Okay, and after that, wash client's eye from the inner canthus toward the outer canthus because soap will irritate the eyes. And after that, wash the client's face, ears, and necks, rinse uh, and dry. So soap tends to dry the face which is exposed to air more than any other parts of the body. So and after that, wash arm from distal to proximal, including the axilla, using the long PM strokes. And then after that, we need to rinse and dry. So long PM strokes stimulates the circulations. And then repeat the procedure on the arms near you. So washing first the arms of the client away from the healthcare provider to prevent contaminations of dirt from the arm near the clients. Okay, so next one, we need also to wash the client's hands in the basin. So both hands, kailangan natin fold the bath towel in half and lay it over bed besides the client. So wash both hands so to prevent soiling of beds. And after that one, we need to wash the chest and abdomen using the long firm stroke, rinse and dry. Sabi ko nga, place the bath towel over the client's chest and fold bath blanket down the pubic area. Wash, rinse and dry chest and abdomen using the long firm stroke, paying attention to the skin folds. So the rationale here is to skin folds accumulate the dirt. Okay, and after that, repeat the bath again. And then next one, we need to expose one leg at a time by folding the blanket towards midline. Place the bath towel under the calf of the leg away from you. Wash with long, firm strokes. So ano nangyayari nun? To provide warmth and privacy. So repeat procedure on the leg near you. And then after that, immerse and wash client's feet in the basin, rinse and pads. So if we immerse and wash fins in the basins, that will be moisture between digits promotes accumulation of microorganism. And after that, we need also to replace the water. So in replacing the water for the sanitary purposes. And after that, turn the patient on his or her sides and place towel alongside the back. Bath beginning on the hairline and washing beginning on the hairline, washing downwards, including the buttocks, using the long firm stroke, giving special attention on the folds of the buttocks and the anus. So dirt accumulates on the folds of the buttocks and the anus. Okay? So place the client also in a supine position and cover with a bath blanket and then wash the perineal area. Rinse and pat dry. If the patient is able, place a towel under the buttocks and bring basin and soap to complete the bath him or herself. So to provide privacy and comfort. So after that one, have the client wear new gown and comb hair, apply lotion or powder, deodorant if desired by the client. So to make our client comfortable. And then also, remove equipment used and store them in a proper place. So leaving the client's unit clean and orderly will prevent accidents and show respect for the clients. And then wag natin kalimutan, wash our hands to prevent the spread of the microorganisms. And next one, we need to evaluate the client's comfort. And lastly, document procedure to include the type of bath administered and client's response. So to contribute to data collections and fulfill the procedural requirements.